That is a true story, so there's room for education. Okay, we're going to shift gears and go to CT. How am I doing? Oh. All right, I'm doing okay. Nobody's really fallen asleep, so that's good. I appreciate you staying awake. And we're going to zip through some CT stuff. And then the thing that I like most about these talks is there's usually some animated question and answer stuff, so I hope you stick around and we talk about that. So to give you an idea, again, how low you can go with the dose, for doing CT stuff, you can go very low. So this is a 15-year-old. Dose is important. 15-year-old with a post-op abscess. So we're looking in the pelvis, and back here is some fluid that needs to be gone. Now, the scary thing is these are blood vessels, so we want to put the drain in the abscess, not in the blood vessel. But to do that, now I learned something. Is Keith here? I learned something this morning from Keith Strauss, and that is that everything I thought I knew about dose length product is probably incorrect. So there you go. So I'm going to say that I'm using this metric, Keith, just so I can compare things. But as Keith taught me, this is not individual patient dose. So let's look. They did a pretty good job. Dose length product was low at 198. So I go back, flip the patient prone. We put the markers on so we can see where we're going, and we're going to go in this area. Now, you'll notice right away a couple things. There is no IV contrast, so I can't see the blood vessels. The dose, the MAS, is very low. Now, at my place, the only thing I change is the MAS. I don't mess with KVP too often. Sometimes I do that for little, real small pediatric cases. I don't mess with the gantry spinning time, and I don't mess with the throughput time. I only adjust MAS because I don't want to overwhelm my technologists or my co-faculty members. But even just adjusting the MAS, we get a nice picture where I can see the target. The target is right down here. So we're going to come in from